Hi everyone, my name is Chelsea Moyer and I am a pharmacist by training, completing my MHA. And today for HPML 523 Healthcare Finance, I am going to be presenting on cost to charge ratios or CCR and price setting under capitation on March 2nd, 2025. So first off, what are cost to charge ratios or CCR? It is a method of costing individual services. So there are two assumptions that you need to be aware of, and the first one being that there are indirect or overhead costs allocated to the services. These indirect costs constitute a single cost that is proportional across all services provided within a department as a whole. The second assumption is that charges or reimbursement rates reflect the level of intensity of the service provided and hence the use of overhead resources. These include both business allocated and department specific overhead. So for an example to walk through, we'll use these values on the slide here today. So there's two services X and Y. You'll have your annual visits, so 10,000 for both of the services. You'll have your direct annual costs, which is listed out here on the slide, and you'll have your indirect or overhead annual costs, which is the same and allocated equally among both. And then there will also be your annual charges and your annual revenues. We'll go through an example of using your charges and then also an example of using your revenues. For the first example of using your charges to find your cost to charge ratio or CCR, for this example, you take your indirect costs and divide it by your total charges. So you'll take the 450,000 of your indirect costs and divide it by the $1,975,000, which is your total charges. You'll get your value of 0.228 or 22.8%. You'll take that CCR and to find your estimated overhead cost for each service, you'll multiply that CCR by your service charge. For service X, you will get $234,840. And for service Y, you'll get $147,060. To then find your total service cost, you'll take your direct costs and add them to your indirect costs. Up above, you just found your indirect costs. So you'll take the values of your direct costs here on the side and add your indirect costs. For service X, that will be $739,840. In service Y, it is $579,060. For getting your average cost per visit, you will just take those total costs that you just found above and divide it by the number of visits. On the previous slide, you will remember that we had 10,000 visits per service. So for service X, your average cost per visit is $73.98. In service Y, it is $57.91. Moving on, you can also do this for revenue. For your cost to charge ratio or CCR for revenue, you'll take the indirect costs and divide it by the total revenues. That will be $450,000 for your indirect costs and divided by your total revenue of $1,230,000 for a CCR of 0.366 or 36.6%. You'll take that CCR now and multiply it by your service revenues. For the service X, that will get you a value of $292,800. In service Y, $157,380. You'll do a similar step where you'll add those indirect costs that you just found by multiplying the CCR by the service revenues and add it to your direct costs. And you'll get a value of for service X of $797,800 and service Y of $589,380. To find your average cost per visit, you'll get your total costs from up above and divide it by the number of visits, which will be the same of 10,000 visits for X and Y. And you'll get for service X average cost per visit of $79.78 and service Y of $58.94. You'll see that the values do differ between the charges and the revenues, and that is because you are using different values, getting different CCRs. So that's just something to be aware of. Moving on to price setting under capitation, I did want to take some time to just talk about what capitation is and the benefits of it. So it does help healthcare organizations control healthcare costs, and it provides incentives for healthcare organizations to control their costs for treating patients since they are getting the same amount per member per unit of time. So there is that fixed amount of money per patient per unit of time paid in advance to physicians or healthcare organizations for the delivery of healthcare services. For the example today, we'll be using per member per month, and so it will be a monthly payment per member for this payer specifically. So often when you do have these types of contracts with healthcare organizations and payers, there will be specific services that you have to provide to the patients to make sure that you're providing ample and sufficient care to those patients. A lot of it is surrounding preventative, diagnostic, and treatment services, trying to be more of a preventative and proactive treatment of patients instead of reactive and treating a condition after it occurred. For price setting under capitation, you want to first understand your current profit and loss statement. For this example, you can see on the bottom left-hand side of this screen that there are 4,000 admissions for a payer with 26,000 members for this example. And the average revenue per admission is $12,000. The average variable cost per admission is $4,000. And the direct fixed cost and overhead is $30 million. So when you're finding your total revenue, you'll multiply the 12,000 by the 4,000 to get $48 million. The total variable cost is the $4,000 times the 4,000 admissions for a total of $16 million. And you'll find that your contribution margin is 48,000 minus 48 million minus the 60 million for the 32 million. Your direct fixed costs and overhead costs will remain the same at 30 million for a profit of $2 million. When you're thinking about obtaining that goal of a profit of $2 million, you need to then understand how much you have to charge per member per month. So you need to generate the $48 million in revenue. To do that and to get that amount from the payer, you need to take that 48 million and divide it by the number of members, which in this example is the 26,000 members. So you'll get a value needed to be paid to that healthcare organization or that physician of $1,846.15 per member. But remembering for this price setting under capitation, it's per member per unit of time. So for this example of per month, you'll take that per member value of $1,846.15 and divide it by 12 months to get a value of $153.85 per member per month that needs to be paid from that payer to the healthcare organization for them to be able to get and generate that revenue of $48 million. So this is just an example of the projected profit and loss statement that you want to see after setting that price under capitation for that per member per month. So when you have the $153.85 per member per month, you multiply it by your 26,000 members from that payer, multiply it by 12 months, you'll get the $48 million in revenue that you need to see. When you also take into consideration your variable costs of $16 million, and you have that contribution margin of $32 million, you subtract your direct fixed costs and overhead costs of $30 million to get your profit of $2 million. So that was an example of how you understand and set your price under capitation. These are my references, and I will accept any questions if you want to reach out. Thank you.